Hi, I'm Dr. Nishath. I'm a maxillofacial and a head and neck oncosurgeon. I practice in and around Sarjapur, Bangalore and Koramangala region. TMJ conditions. TMJ conditions are basically TMJ is a paired joint which is called temporomandibular joint. Conditions like clicking, popping, joint noises while opening and closing of mouth, subluxation, dislocation of the joint, being stuck in an abnormal position are all collectively termed as temporomandibular disorders. These conditions are very common and can be associated with habit profile of clenching, bruxism or teeth grinding. Could be related to osteoarthritic changes also within the joint. TMJ is a joint which is constantly under a lot of stress and strain while chewing, eating and increased masticatory load like faulty dental fillings, lack of alignment with upper and lower jaw. As a result, the load forms into the joint area. What is the treatment for TMD disorders? Basically, it depends upon the grades of TMD condition you are in. Generally, it is start with the muscle relaxants by relaxing the muscle so that if there is a habit clenching profile, these medications could help you to give you symptomatic relief. In case of severe grinding and bruxism habit, we advise for a splint therapy. So that could be worn in the night and slept, and you can avoid the joint loading tendencies during this process. Or we can also treat accordingly with the help of Arthrocentesis or Arthoscopy. Arthrocentesis is a technique of flushing in the saline into the joint space by removing a lot of debris and inflammatory mediators in the joint. Arthroscopy is a technique where we put two cameras in the joint in order to evaluate the size, shape of the disc in case of its shape and change in the position as well. Other procedures are surgical procedures where the joint is directly addressed by open surgical procedures. In case of a severe dislocation and those kind of conditions, we advise for eminectomy procedures and various other procedures like capsulorrhaphy, discopexy. So these procedures are helped in placing the disc in position as well as they will give you an immediate effect from the treatment.